very courageous. We can deal with anything boldly, and they are boasting about their courage and their lion-like image everywhere. But then, when they face real sickness, you see their cowardice because they're afraid of a long torture due to illness and revealing their lack of courage to others. What if other people see and they will notice that I'm not so brave after all? you know so it's a kind of, Lycopodium is a very shallow person from within. So it is clear that a simple rubric, anxiety about health, is actually full of wide varieties of shades and subtleties which are crucial to the precise choice of a correct remedy. This is true of every rubric, as a matter of fact, in the repertory. The same is true of another rubric describing prominent arsenicum anxiety for others. As one would expect from what has already been said, arsenicum does not have so much of a concern for others per se, but rather fear of losing someone close to him. Again, his anxiety is based on concern for himself. Consequently, he will show little concern over someone who is a stranger to him. If you're a stranger to the arsenicum patient, they will have no concern about you, whether you're alive or dead. And that I experienced eventually. But they have a fear of losing somebody who's very close to them, if it is their daughter or their son or their wife. It is a fear of loss of someone upon whom he is dependent, somebody who is dear to him. If it is just the next person, maybe somebody who is working with them, or somebody who is a brother, or somebody who is an uncle, they wouldn't mind so much. They would show little concern for such a person. Phosphorus, on the other hand, is so sympathetic and suggestible that he can lose all sense of himself in his concern over someone else, whether a close friend or a stranger. If an arsenicum person were to meet someone new to the area, he would welcome the company but would make conversation merely for the sake of the company. If the person were to mention, say, difficulties in finding a hotel, the arsenicum patient would courteously express consolation, perhaps make a few suggestions, but his attitude would basically be, well, you have your problems, but what about the problems I have? The phosphorus patient, on the other hand, would be excited and say, you have no hotel? Oh my goodness, we must do something about that. Here, we'll go right now to the directory and try calling a few. Sulfur also has an anxiety about others. In his instance, it is his active imagination which leads to the anxiety. A sulfur father, for example, might lose sleep worrying about his daughter coming home 2 hours late from a date. It is not the arsenicum anxiety over losing his daughter or the phosphorus sympathetic anxiety. The sulfur type will lie awake inventing endless possibilities about what might have happened. This happened to me. Can you believe it? Lie awake inventing endless possibilities. I underlined it. About what might have happened, He will allow his imagination to blow the whole incident out of proportion to the reality. So in sulfur, the anxiety about others is real, but it is about people who are close to the patient, and they might worry thinking that something bad may happen to that person. I have patients who are on sulfur, and some of them have expressed this symptom, that they feel anxious about their children who are working somewhere else, and they imagine bad things, because when they read newspapers and or they see these reels, they get these feelings that what if this happened to my daughter or to my son or to my close person, So this is sulfur. Let us return to the stages involved in arsenicum. The first stage emphasizes the physical symptoms, the fastidiousness and the stinginess. Then we see an increasing emphasis on the insecurities, dependency, anxiety about health, anxiety over losing others, the fear of being alone, and the fear of death. Gradually, the fear of death becomes an obsessive, anguishing fear, the central issue of the person's life. They're always afraid they will die. How they will face that vacuum of death. As the illness progresses, we see the emergence of a paranoid, delusionary state. Suspicion dominates the picture, and that is the stage I think that my patient is in. Once the paranoid state develops in a case, we frequently see the fastidiousness would disappear. Eventually, the anxiety and fear diminish. as a deep state of depression sets in, a despair of recovery, a loss of interest in life, and the suicidal thoughts, suspicion of others, and the fear of killing people upon whom he depends. If you read the Bible, you will find a character who had all these final symptoms, Herod the Great. This is how he died in the end. Despair of recovery, loss of interest in life, suicidal thoughts, suspicion of others, to the point of killing them. The fear of killing people upon whom he depends. So he's afraid of killing the same people whom he depends upon. Like they would kill their daughter or son who may come in the way of their aspiration. In this stage, the person may even avoid talking to people. Perhaps he becomes obstinate inward. It is in this stage of insanity that one may find the most difficulty prescribing arsenicum without a knowledge of its stages. Many of the usual symptoms of arsenicum may be missing: anxiety, desire for company, fear of death, restlessness, fastidiousness. It may be difficult to separate arsenicum from Noctronica or other remedies at this stage. But if the case is taken carefully, the full dynamic process will become clear. The stages described herein illustrate nicely the progression of pathology steadily into deeper layers of the organism. It begins on the physical level, progressing into a state of anxiety and insecurity, then to a fear of death, and finally despair, a loss of interest in life, suicidal disposition. Arsenicum commits suicide by hanging. And a delusionary stage on the mental plane. Consequently, under correct prescribing of arsenicum in such a case, we can expect a reversal of this sequence. As the paranoia and delusions lift and the fears and anxieties return, the homeopath with a true knowledge of health and disease will recognize progress in the direction toward health. So some people may become anxious if anxieties return. So people will say, well, he used to be depressed, but now he's anxious. And this is far more worse than being depressed. But when you take the case, before he used to be very anxious and then he became depressed eventually. And now this is reversing. Direction of cure is always in the reverse order of appearance of symptoms. So do not despair. I'm talking to the homeopath. If you do not get immediate results, we are treating the patient from within. We are offering them the best treatment possible. We are not just alleviating their certain pains and aches and controlling certain developing stages of diseases. We are curing them from within. And if we invest our time in knowing people, that's what I do. In ministry also, that's what I do. We need to know people, understand people. If we invest our time in knowing people and distinguishing them from each other and finding their finer traits, we would start loving people more, of course. We would appreciate their beauty. We would understand their vulnerabilities. And we would be able to much more relate with them because this is how they are. It is their personality. It cannot be changed. And we would be able to prescribe right remedies. And if we prescribe right remedies, they may work like magic. And people may get healed. Chronic sicknesses. I've seen people with asthma who could barely breathe, completely healed. No asthma, nothing, no sign of it, And I've seen people who had gastric complaints and, they couldn't go anywhere because of this gastric distress. They avoided every travel they planned because of the gastric problem. And now they travel freely. They're completely healed. And there are people who were afraid of participating in certain sports and certain games and certain things, certain professions because of certain conditions on their skin, and the skin conditions are completely healed, and they are now free. They can go out anywhere. They can participate in anything they want to do. And more than all these things, there are people with endocrine illnesses who seem to be very difficult to heal or cure and took much time, but they were healed eventually, many of them. And there are some people who are getting healed. And then we have these chronic sinusitis, people like with headache who used to come here and say like, I cannot bear this, somehow. They are now expressing relief as if some big burden has been lifted off their shoulder. And that is when the people would start respecting the homeopath. They would develop a deep relationship. And this is a guy who gave me that thing which healed this problem which I had. And there are people who with constipation, like it's a big struggle going to stool. It's not coming, or it's coming. It's very hard. It's first liquid and then very hard. First solid and then liquid. And sometimes crumbles. Sometimes there is blood and gas and many other complaints. And now they don't have to suffer any of these. They are fine. And they don't need to be afraid. And they can go anywhere, eat anything they want to eat. People who were afraid of eating cold food, ice creams and everything. And now they are enjoying all these things, cold drinks, ice creams, and beach and sea, and wherever they want to go, mountains and valleys. So the point is this: it requires patience, perseverance, and it requires acute observation to get to the understanding of the person first, and then to compare them with the remedy and get to the right medicine next. And if we strike gold, like if we match them perfectly, there's nobody stopping us. Nothing can stop a homeopath from curing their patients. Now, see, I have seen so many times these cures happening from within outwards, and from outwards within, the disease progressing from outwards to inwards, that I'm almost certain that this is the way it happens. So with experience, we would know what is happening. It may be difficult for us to educate the patient at the time. They may feel like their disease is progressing, or are they going to get healed? And there are patients who just stick with us. There are some people like, he just believed, he just stick. And all the kidney stones are gone completely. And there were some others who were very close to me, and I thought that they would continue the treatment. They didn't. They just stopped it after 1 or 2 months. They didn't get the expected relief. But this particular patient of the same kind of kidney stones, they just stuck around. They just knew somehow inside them that it takes time, and they need to be a little patient and give their symptoms in detail. And they did that. And with every detail that they mentioned, I'm sitting here with my books, and particularly this one, the repertory, and trying to find out which is the most accurate remedy for them. And sometimes I juggle with a few, and eventually I reach the right remedy. And once I reach the right remedy, and I know, and they know, and that is how it works. And this guy is now had 5 or 6 stones in the kidney. All are gone. I think there is one more remaining in the other kidney. But see, that is how things happen. So if you are a homeopath and you need some encouragement, you may not see many patients every day. It's not about how many patients you see. It's about how well you take each case and how you treat each patient, how you differentiate between these people, the people of the Materia Medica. You identify them, and then you reach the highest potency for that particular patient, which is the most similar remedy, and heal that person. And that is when the reward would come. You may start with a few remedies which are almost similar, so you don't know which one is the right fit. You'll go with 30 potency of one, 30 potency of the second one, third one, and then you see some changes happening. You go to the 200s, and then you see the symptom picture has completely changed, and then you go to a group of medicines, and another remedy is given 30, 200, and then you reach 10 of one remedy. It works for some time beautifully, and then again symptom pictures change. Then you see that, okay, there are some other miasms, some other things lurking behind the scenes, and you work with the patient, and you get rid of all that is blocking the healing from happening, the obstacles. Sometimes some intercurrents are required, some chronic deep acting medicines are required, and eventually you reach that particular potency, maybe a 50m or cm, where you are certain that you would have a cure of the kind that I described, where the patient enjoys health. It's not just not having sickness, it's about enjoying health. God bless you. Have a great day.